finish up with range of motion. um, your range of motion, my range of motion, range of motion of a person is just the extent of how far or at what range we can move at a joint. So you're going to have some joints that have more of a range than others. Of course, that makes sense. But anyway, so that's what range of motion is. Now, range of motion in the healthcare field, what we consider range of motion, this is just an exercise, if you will, kind of an exercise or a stretching exercise to help people basically to keep movement of their particular, hold on a second, basically to keep particular joint moving, or if they are they're having difficulties, you know, getting up and down out of their chair, moving, if they're bedridden, if they're wheelchair bound, those are all reasons you'd want to do range of motion exercises with someone. Because if you guys will remember, last year I said a word, contractures. And one of the things that can happen with someone who isn't getting a lot of movement, either in a wheelchair or in bed or wherever, is their muscles will basically stay in this constant state of contracting. And so what happens is it's very, very, very painful. At least it is, unless they have paralysis or something like that. But it is painful, at least to move them. But the muscles it's almost like they like harden. They just get very, very stiff. And you have probably seen someone before, but someone, for example, who's paralyzed on part of their body from a stroke, you'll see that a lot of times in their hands, they'll curl up, their muscles will contract, and their hand will curl up, and it's just like everything you can do to get them, relaxed. And so it just takes time, and the best way to keep from getting contractures is just to prevent it. Very, very difficult to do something about once they are actually there, but it's just to prevent it. Range of motion exercises do that. Like it says, it can prevent problems by lack of movement or inactivity. Like it says, contractures, atrophy. If you'll remember, atrophy is just a lack of muscle development or decreased muscle development, stiff joints, blood clots, and then decubitus ulcers. Okay, if you get people moving where they can move around more, you're going to decrease the risk of decubitus ulcers because movement gets blood flow going. So. Passive range of motion. This is where the patient is unable to perform. Okay? Active range of motion means they can do it themselves. So passive range of motion. Okay? So for example, I've got myself here. Okay? Passive range of motion means if I've got a patient, I'm going to take their arm and I'm going to move it for them. Okay? So their arm is loose, I'm going to move it for them. And you just move it until you feel resistance. Okay, so I've got my own, I'm going to push it backwards, I'll move it forward or whichever way I'm going, and I'm going to, until you get resistance, and then you just hold it there and let it relax. You do the same thing, it's repeated. That's passive. Active range of motion means the patient does the exercises with just a minimal assistance. So they're actually able to move themselves, but they may just need a little bit of assistance from you. Okay, range of motion rules. You want to make sure that you always use good body mechanics. Again, you're going to be helping them move, walk, transfer. You may have to do their leg, and their legs are going to be heavy. So make sure you use good body mechanics. Keep your back straight. Use your leg muscles. Use your arms. Expose only the body parts necessary. Okay, I'm not going to strip them down and then say, okay, work all of your muscles. No, I'm going to take their arm. It depends on what's necessary, but I'm not going to leave them exposed. Explain what you're doing. Always, always, always. I'm telling you guys, as long as you communicate with your patients, they will love you. I don't care if I don't care if you give the worst shots of anybody you've ever known. If you communicate, they're going to like you. They'll say, man, she's sorry at giving shots, but I really like her, or him. So, and then support the extremity that's being exercised. Move each joint, like I said, until there's resistance, but not necessarily pain. Now, sometimes that changes a little bit, like I said, with the contractures. Make sure you do it slowly, and then always return their joints to a neutral position. Keep friction to a minimum. Why? Okay, remember we talked about friction, pressure, friction, anything that rubs against the skin, okay, is going to cause skin breakdown, which leads to pressure sores. Not something we want to give people. And then you repeat each one 3 to 5 times. Okay, let's look at these joint movements. Okay, these are different ways in which you would do range of motion. And you guys will want to write these down. Okay, if you'll remember abduction, you guys should remember that one. Remember, abduct means move away from the body. So this is abduct. Abducting my leg. Here, I'll turn this off so. Turn this off for a second so you can just see me. Okay. So abduction. Okay, I'm going to move out, away from the body. If you remember, abduct, take someone away. If you abduct someone, you take them away, so it moves away from the body. Okay, adduction means it's moving towards the body. So abduct, adduct. Okay, so adduction is moving back towards the body. And it doesn't just have to be the arms, it can be the legs too. Okay. Flexion. This is where you bend at a joint. So flexion, this is flexion of your arm, so forth. So that's flexion. What's next? Oh, extension. So extension is just, it's like what it sounds, extending. So what happens in flexion is the muscle that you're actually exercising is contracted. Extension means it's not contracted. Okay, so it's straightened. Hyperextension is just moving past that what is normally within range. Not necessarily what is normally within range, but just moving it past the neutral position. Okay, so if I can't hyperextend my elbows because I can't even straighten mine out all the way. But if you hyperextend your knee, it moves past that normal neutral position. Okay, rotation. Rotation is turning the foot or leg toward the other and then back out. So talking about rotation is moving on an axis. Okay, this is rotation. Your leg, I'm rotating my leg. Let me move so you guys can see my legs. Okay, you still can't see me. I'm moving my leg this way. Okay, rotation. Pronation. Okay, prone, if you'll remember, means face down. So if you've got your arms in anatomical position, pronation means I'm facing my palms down. This is pronate. It's actually a forearm movement. Anyways, pronate, and this is supinate. Pronate, supinate. Pronate, supinate. Inversion, turning the sole of the foot towards the middle. So this is inversion, like when you roll your ankle, when you roll it to the outside. That would be inversion. And then eversion or extroversion, I've heard it called extroversion too, is moving it out. Okay, so anyway. What's next? Dorsiflexion. This is where you move the foot backwards and so that your toes are pointed. Sorry guys, I'm trying to watch myself in the video here, but it's opposite of me, so. This is dorsiflexion, okay? This is plantar flexion. Neutral position is where your foot is at just a right angle. So remember dorsi means back, so I'm pulling my foot back. That's dorsiflexion. And then plantar, remember your plantar surface is the bottom of your foot, so that's plantar flexion. Radial deviation is where you move your hands side to side at the wrist. So like you're waving at someone. It's radial deviation. And what else do we have? Well, let me rephrase that. Radial deviation, you move towards the radius. Ulnar deviation is you move towards the ulna. Okay, like you're waving. And I think that is it. I do want you guys, you have a range of motion checklist, and I want you guys to go through that, practice on each other, practice passive range of motion. Now, as far as your skills check, when I'm going to have you guys check each other off, you guys will I don't think probably you guys have the equipment to do the bed and moving someone from a bed to a chair. If you do, great. I want you guys to do that. I do want you to go over that procedure so you can answer on a test what you would do with those, like moving someone in bed or moving them from bed to wheelchair and back and forth. So I do want you guys to be able to do that. You can, I'll try to find some YouTube videos and put on there something. But the main thing for you guys, whenever you check each other off, I want you guys to do the range of motion. Okay, and we'll just do upper arm range of motion. Anyway, so I'll let you guys practice that. And we're good for the day.